a Master of Public Health student at the University of North Dakota, and I will be graduating in May with a degree in Health Management Policy with a certificate in Population Health Analytics, and I also have a graduate certificate in American Indian Health as well from North Dakota State University. And today we're going to be talking about public health policy in North Dakota. It's not just for nurses. I am an intern at the North Dakota Association of Counties this past year, and the main job I've had with a law student as well is breaking down the North Dakota Century Code into a usable SparkNotes version so that health unit administrators can just flip through it and find what they need. And we'll talk about that a little bit later as well. But today we're going to be talking about public health infrastructure in North Dakota, the current scope of practice for health units per the North Dakota Century Code, legislative changes and a new bill, and public health advocacy in North Dakota. So first we need to define public health. It is the science and art of preventing disease, prolonging life, and promoting health through organized efforts and informed choices of society, organizations, public and private communities, and individuals. And health is not only the absence of illness, but the presence of wellness. I get all my stock photos on this presentation from the North Dakota tourism site. So here's just some bikers out on the western side of the state, improving their wellness. This year we celebrate 100 years of public health in North Dakota. In 1923, the State Department of Health was formed. However, we do have some prior public health milestones as well. In 1862, the Dakota Territory passed a law prohibiting adulteration of food or drugs at the time. At the time, there was no FDA, and people could put whatever they wanted and say whatever they wanted it was. So the Dakota Territory remedied that. In 1873, local public health agencies were put in place until statehood. And in 1889, the State Board of Health was established, but it wouldn't be until 1923 that the State Department was formed with divisions that are quite different from today. That included vital statistics, preventable disease, child hygiene, nursing, and engineering. And I still don't know what that engineering entails, but I'm glad we've moved on from there. In addition to discussing public health and what health and wellness are, there are 10 essential public health services that have been decided upon by the Centers for Disease Control and Prevention. They've been around, probably for the past 50 years, but they were revised in 2020 to include equity at the center of the wheel. There's 3 main domains that are assurance, assessment, and policy development, and all 10 of those functions fall within those. The functions are as follows. Firstly, we need to assess and monitor population health. We need to investigate health hazards, diagnose and address health hazards at their root cause. We need to communicate effectively and inform the public. We need to strengthen and support mobilized communities and partnerships, create and champion and implement policy and plans and laws. We also need to utilize legal and regulatory actions, assure system access and services, and build a diverse and skilled workforce. We need to improve and innovate through evaluation, research, and quality improvement, and maintain and build strong organizational infrastructure for public health. And equity is at the center of the wheel because the movement within social epidemiology and social public health is to address the disparities that we see in the United States. So health equity, which is at the center of the wheel, is the state in which everyone has a fair and just opportunity to attain their highest level of health. Achieving this requires focused and ongoing societal efforts to address historical and contemporary injustices, overcome economic, social, and other obstacles to health and healthcare, and eliminate preventable health disparities. When discussing disparities, it's important to keep in mind the social determinants of health, which are conditions and environments to which people are born, live, learn, work, play, and worship, and age that affect a wide range of health functioning, and quality of life outcomes and risks. Some examples of the social determinants of health in the United States today include race, gender identity or sexual orientation, age, location, education level, socioeconomic status, adverse childhood experiences, and many more. So the picture on the right is just a visual of equity and why some communities are focused on more than others due to historical disparities due to systemic inequality. So some of the groups that North Dakota is focusing on are Indigenous peoples, LGBTQIA individuals, rural people, and elders. In North Dakota, the North Dakota Department of Health and Human Services did start a health equity push in maybe like 2016 through 2018, and now it is called community engagement, and it is a subsection within a section. And the community engagement team has grown, and it includes Director Chrissy Gerard, an assistant director, 2 community engagement specialists, 2 CDC Public Health associates that are from a grant program that using federal dollars, 4 tribal health liaisons for each tribal nation in North Dakota, and 4 graduate assistants. In 2022, a health equity committee was formed to oversee the community engagement subsection of Public Health Division with professionals from all over the state to identify key objectives, goals, and communities to focus on in North Dakota. In 2022, as of September 1st, the 2 departments of the North Dakota Department of Health and North Dakota Department of Human Services merged to create the North Dakota Department of Health and Human Services. It's 1 department, but with 8 divisions. The divisions include behavioral health, communications, finance, human resources, human services, legal, medical services, and public health, which is what we'll be talking about today. Here's an organizational chart for your reference as of November 2022. Services within the Public Health Division of the North Dakota Department of Health and Human Services include adult, children, and community health. Adults are further split up into women and men. And the Public Health Division has 5 subsections that include disease control and forensic pathology, healthy and safe communities, under which will be those health equity pushes, health response and licensure, laboratory services, and health statistics and performance. The division also has 4 main goals that were identified in 2022 that include creating healthy and vibrant communities, enhancing and improving systems of care, strengthen population-based health interventions, and promote public health readiness and response. And you can look at the division's page and find objectives and how they plan to measure that as well. Here is a org chart for the Public Health Division. And now that we talked about divisions, we'll talk about the health units. Though the departments are merged, health units are different than human service zones, and they will remain different as far as I'm concerned. ND Seiko did get some questions about this, but I'll explain it a little bit further in the next slide. Health units are defined per the North Dakota Century Code, and they are independent, so they are not overseen by the Division of Public Health. North Dakota has 28 independent health units that fall under 5 structure types, and this is unique to North Dakota. There's no other state with 5 different structure types of health units. They include city-county health departments, city-county health districts, multi-county health districts, single-county health departments, and single-county health districts. This is the slide that explains health units versus service zones. Service zones are governed and split up by the North Dakota Department of Human Services, and health units are independent and created through the North Dakota Century Code. They do get funding from the state, but how they choose to govern is up to them, and they can autonomously decide to dissolve or merge together to create new departments as well, which is why we have some of the bigger districts on the western side of the state. Human service zones don't have that independent ability and autonomy. So the first type of structure is a city-county health district. To my understanding, departments are governed by either city or county commissions, whereas districts are governed by boards of health that can be appointed by commissioners. So the city-county health district is Barnes County. There's only one, the one and only. Barnes County chose to switch from a city-county department via the North Dakota Century Code 2335 in 1992. Rather than county or city commissioners, Barnes County, also known as City County Health District, answers to the District Board of Health for both city and county issues. There are 3 city-county health units, and these are departments. So we have Fargo-Cass. Fargo contracts with Cass County for a lot of services. The board is only advisory, and the unit is governed by the Fargo City Commission under Home Rule Charter. So it's not governed by the County Commission. Grand Forks, the Board of Health members are appointed by the Grand Forks Mayor and confirmed by the City Council. And in Bismarck-Burley, Bismarck contracts with Burley County, but they have separate boards of health for the county and the city, and they're appointed by their respective commissions, City Commission versus County Commission. And the boards of health are advisory to my understanding. If you see anything that needs to be corrected, you're the experts, please feel free to email me. I'll include my email at the end. Single county health departments. There are 6 county health departments in North Dakota. These counties have boards of health that are appointed by county commissioners. The boards in these counties include at least 1 county commissioner and a practicing physician as health officer for the county. Fargo, the health officer, is not part of the Board of Health. So there's just nuances between every single unit in the state of North Dakota. And finally, single county health districts. These county districts are not associated with city health departments and have their own governing board, rather than a board appointed by a city or county commission. However, county commissioners may be on the health board. And finally, we have multi-county health districts. These districts were formed because in the 1990s, there were parts of North Dakota that were not part of any health unit, and the state legislature wrote into the Century Code that all land or all counties needed to be covered by a health unit by 2001. So these health districts were formed, and they are different than human service zones, so there's the difference there. Firstly, there's Custer Health Unit, and the name change is happening May 1st. The unit will then be known after May 1st as Western Plains Public Health. There's the Southwestern District Unit, Upper Missouri District Unit, 1st District Unit, Lake Region, Central Valley, and Nelson-Griggs. Regarding the Century Code, any of these districts can decide they want to dissolve, or if different health units want to merge, or if new health units want to form. It's all under the North Dakota Century Code 2335. And our guide helps lay out step by step if a health unit were to choose to create a new health unit or break away from its own health unit. And it's a easy read version, like I said, Spark Notes along with the Century Code, so that step by step, if a health administrator needs to know how to go about doing a nuisance abatement paperwork or working with law enforcement on that, we do have a step by step and some case studies as well to help health units understand the Century Code a little bit better and get work done in a little bit more timely manner. This manual was at the request of health unit health units because of COVID-19. It was difficult to discern jurisdiction or who had authority over what sometimes based on all the different type of health unit structures in North Dakota. So the idea for this guide was to be a quick version to better understand what authority health units have in North Dakota. Per the North Dakota Century Code, and these will all be included in our manual, in addition to health district formation that I talked about, health units have authority over wastewater and septic within units, nuisance abatement. The Century Code also lists boards of health powers and duties of local health officers, and it also discusses budgeting if a district were to want to sell some of the property it acquired and different things like that. In addition, the manual also includes parts of the Century Code that doesn't necessarily fall directly under health units, but it does apply to health units. So we have a section outlining communicable disease and confinement procedures that aligns with the North Dakota Century Code, that aligns with HIPAA per the Century Code, and we are working on food and lodging. But there are some possible changes after this legislative session, and I do need to look into that more. In addition, we will include home rule charter, which is how some of the health units are governed. Fargo was an example, uses home rule charter to be governed by the city commission versus the county commission. So hopefully there's some more information on that. I'm working on that right now. And to go back to those 10 essential functions, because of COVID again, health units were not quite sure what they had jurisdiction over, and it wasn't clearly laid out as to what exactly health units were to do in the Century Code. So there was that lack of written in law to back up health units, or if they were to be part of a case, to have it written in that, well, we're supposed to do X, Y, Z. So health units worked with NDSACO and the Association of Counties to write these 5 core functions that were in Senate Bill 2153, introduced in January and signed into law at the end of March by Governor Burgum. So this will be included in the Century Code. So now we'll include it in the manual as well. And the 5 core functions that were included were communicable disease control, chronic disease and injury prevention, environmental health, and maternal, child, and family health, and access to clinical care. So these are some of the main goals for public health in North Dakota that are codified in the Century Code now. I also, for this presentation, looked up, we have had some questions about budgets. I looked into the North Dakota Executive Budget at the Office of Management and Budget under the Transparency section, and this just lays out Governor Burgum's plans, and nothing is cemented, I don't believe, for the 2023 to 2025 year. This was new to me, but I'm sure you all were all more in the know, but the governor would like $55 million to make a new public health and environmental quality lab, in addition to the $15 million that were allocated in 2022, I believe. $3 million for public health emergency response and preparedness, $3 million for public health and well-being under the Department of Health and Human Services, $3.3 million for public health state aid, and a recommended supplemental appropriation of $25 million of special funds, which is approximately 30% of the budget, to the Department of Health and Human Services for extension of public health emergency and Medicaid enrollment. This is different than Medicaid funds that are allocated federally to the states. And finally, to wrap up our public health policy, North Dakota SACO does have a really cool sheet on the front that has some legislative priorities, and since they're 23 to 2025, you can kind of see how they fit into the budget if you choose to download the PDF of the executive summary. And these priorities include securing state aid funding, environmental health, behavioral health, and tobacco and substance use prevention. And Mary Korsmo has a handout that kind of goes into these a little bit more, but I didn't want to make your screen super busy. And finally, just some resources for North Dakota policy and advocacy. The North Dakota Association of Counties and Association of City County Health Officials has a great page. The North Dakota Rural Health Association is a great resource, and the North Dakota Public Health Association does send out emails weekly during legislation if you are a member that has bills to watch and bills that are relevant to public health. So I think the membership for me, a student, is only $20. I don't know what it is for a unit or for your group, but that's a really great starting point to understand what's happening in public health legislation in North Dakota. The Center for Rural Health and Rural Health Information Hub has some great toolkits for advocacy and policy specifically to rural areas. And I interned at the National Rural Health Association, so I have to plug them for sure. Okay, and this is my email. For any questions, comments, or feedback, please let me know. If I got anything wrong, I absolutely want to know because I am learning. I've only been doing this for a year, and you've all been doing it so much longer. Also, our law student is not on the project this semester, so I don't have that legal knowledge as much. I can read and read, but I don't have a formal education in law. And please, if you have any questions, comments, concerns, any corrections, or if you would like your unit to be described differently than I described it, which is how it's going to appear in the manual, please let me know. My email is all lowercase, and I'll say it out loud in case you're not looking at the screen. Claire, C-L-A-I-R-E .s.erickson, E-R-I-C-K-S-O-N @ndus.edu, all lowercase. And thank you so much for listening today.